So we're going to dive into just how we can improve the function of your foot and really just things that we're looking for foot health. And people have a lot of issues with their feet. There's bunions, I have a flat foot, I have a high arch, my arch isn't turned on, I have a post-tib issue, I have a plantar fasciitis, which tends to be in the heel here. But I want to talk about just an issue with the foot that if we can fix this, a lot of things just tend to work well. And the name of this is, it's sometimes called forefoot supinatus. It's also called forefoot varus, where we look at the foot, if we have this incline here, where we call this the first metatarsal, if this, which is where the big toe is, if this is elevated, we're looking at it here, if this is stuck up, what happens is when you hit the ground, your foot has to cave in from the backside. If this is up, we tend to get this overpronation effect and this flattening of the foot because we call this first metatarsal, it's stuck up and it can't get down. So what we can do is we can do certain exercises and strengthening exercises to help to get this bone down. Now, this can happen for a couple different reasons. Excuse me, it's myself. I have a flatter foot, and this tends to be an issue for me. So I actually do a lot of just intrinsic foot muscle strengthening that we'll talk about, but also I strengthen the inside and outside shin muscles. On the inside here, this is just like the lower part of the tibia and the fibula. It goes all the way up to our knee. There's muscles that start, they're way up here, but they start on the back side of these two bones. One of them actually starts up here, close to where the knee is. It wraps down, wraps around your ankle bone, and inserts into the bottom of the foot, which the motion, we call it inversion, it does this. But also there's another muscle that's in a very similar area that actually originates on the fibula bone. That muscle, it looks like a feather, runs down probably about yay far, and then it's got a long tendon, wraps around here, and that actually goes into the big toe. So if we have this issue where this bone is higher up, we can actually strengthen, we can use this muscle, press the big toe into the ground, and you can actually see it here as as the big toe comes down, this follows suit. So if we can get this to press down, right, press my big toe down, this called the first metatarsal again, that will also anchor down. So if we can get this muscle to turn on, there's also an intrinsic foot muscle that goes through these two little bones here on the bottom of your foot. If we can get those on, it's an intrinsic foot muscle that attaches close to the heel bone here, or close to the kind of bottom of the foot, closer to where this area is. That will help anchor this big toe to the ground, help anchor this first metatarsal. So number one is, if we want to fix this foot that's elevated like this and help anchor it down, let's get that big toe pressing into the ground. Let's start to press our big toe into the ground. Second thing is we can actually work on, we call it the peroneal muscles. Now on the inside, we call it the post-tib, and it's called flexor hallucis longus, which is that really long feather-like muscle with the tendon. That's kind of where a tendon would be, the muscle part would be the feathers, and a tendon would be that kind of central part where all the feathers actually stick into. We have one on the outside as well that starts way up here, and it's got a long tendon as well, goes all the way down here, wraps around. One actually inserts here, but the one I care about, it goes all the way underneath the foot, attaches to the bottom part of this metatarsal. So when this muscle, again, it's way up here, when it contracts, that tendon goes all the way around, wraps around, and the motion, it will help, we call this eversion, it will spread the foot this way. But if the foot doesn't move and that muscle contracts isometrically, well, for the most part isometrically, especially when we're running, it actually will pull that down, which is exactly what we're looking for. It's fantastic. So a two-way approach of really improving your foot health is pressing the big toe into the ground to help anchor that first metatarsal, and also strengthening, we call them the everters, which is the foot moving this way, which you can just get a band, and I'm long sitting and the band's anchored over there. I can start to resist. I'll show you guys actually here. You get this, which I have videos for these. We got this band going like this, right? It's pulling us in. We can actually resist that. It's hard to do it with just two hands here, but I can go like this, and I can strengthen that muscle. So two ways to just start really improve your foot health. And if you have a flatter foot, this is a fantastic way to start to get that first metatarsal down and improve your foot health. Is press the big toe into the ground, perform these ankle eversions, and feel free to get heavy with them. A lot of times I remember when I was at clinicals as a physical therapy student in Buffalo, New York, when we give people these exercises and just give them nowhere near the load that they need to see a tissue change. So feel free to get heavy with these. Like this is probably a little bit too light. I use a heavier band. Do a 10, 12 rep max. I'd love to get down to an 8 rep max, but you want to be fatiguing with these. The big toe, it's a little bit harder. You just got to press it down into the ground and hold it. But strengthening these muscles can have a massive, just a beneficial effect on your foot health.